Hello and welcome to the Birthing Center here at PeaceHealth Southwest. My name is Julie Douglas. I'm one of the childbirth educators for our Birthing Center, and today we're bringing you a tour, an online tour of our Birthing Center. During these uncertain times with the coronavirus, we are temporarily suspending our usual in-person tours for our patients and instead bringing that to you online. Bear with us as we are not professional camera lady or in front of the camera person, but we just want to make sure you get all the information that you need so you're prepared for your stay in our Birthing Center. To begin, I want to point out our parking lot here. When you arrive to the Birthing Center, whoever's bringing mom in, feel free to park right over here. We have a little bit of a turnout alongside our driveway where you can temporarily park your car, get mom in the front door, checked in and where she needs to be, and then you can move your vehicle out to our parking lot. We do have several spaces directly across from the entrance, but the majority of all of our parking happens down the drive there a little bit at the end of our building. And there's always plenty of parking there for our patients. So let's go ahead and begin by heading into the front doors of the Birthing Center. Things are going to look a little different here than they normally would when there's not the coronavirus going in. Again, a lot of things have changed, and we understand that in this time where it feels a little, can be scary for some of our patients, we want to assure you a few things. Number one, if you have any questions, concerns about your health care, about your health and safety, we encourage you to be talking to your doctor or midwife about those concerns. When you come to the Birthing Center, we're doing everything we can to assure that you will be safe, healthy during your stay, both you and your baby. So it's going to look a little different as we walk in. I'm going to show you that now. One thing I love about our Birthing Center is that when you pull up in front, you're here at the front door. There's no hallways and elevators to navigate, but you're right here in the Birthing Center. So when you come in, you'll come through this first set of doors, you'll come into the second set of doors here, and they are locked. We are a locked unit, which means 24 hours a day these doors are locked. So don't be deterred if you come to the locked doors and think, oh, I need to go in a different entrance. No, doesn't matter what time of day or what day of the week, this is always where you want to come if you've been sent to the Birthing Center or if indeed labor has begun. So a few things that look different. Number one is our coronavirus health alert here. This just is warning some of our visitors and patients of what to expect, and you'll see here we're only allowing one visitor to support mom during her stay. That one visitor needs to be the same visitor during mom's entire stay. So that number one support person will be your support person during your stay here in the Birthing Center. Also here at the entrance, we have a hand sanitizing station. Feel free to use hand sanitizer. Best way to prevent the spread of germs, including coronavirus, is hand washing. Hand sanitizer or soap and water. Here we have hand sanitizer for you. Also facial masks, if you're concerned at all or you'd feel better and safer wearing a facial mask, go ahead and grab one of those for you or your support person. So the doors are locked. How do we get in? There's no knocking or jumping up and down. All we need to do is use the intercom system. Right here on the door, you just push the button, and that's going to alert the receptionist or the nurse's station. They're going to see through the camera who is it standing here, typically women with big round bellies, and they're going to push the button to open the door. Or they may just choose to communicate. If they're not sure who's standing out here or why this person needs to be here, hey, yeah, I'm here to have my baby.
Come on in, take a look.
And she's going to open the door for us. Boom, that's how it's done. So in we go now to the receptionist's desk. Now, another change with the coronavirus is we're going to be taking the temperature of anyone who walks through. Mother, support person, employees, everyone gets a quick check to make sure that there's no fever going on.
98.4.
So then at this point here, our receptionist will check mom in, pull you up in the system, and typically after we check you in, the next place we take you is to our triage area. So let's head that way next. All right, mom, we've got you all checked in with the receptionist. This is the next place we typically take you, is to our assessment area. Before we get you checked into a birthing suite, we want to make sure indeed labor has begun. So we're going to bring you into our assessment area. They're very small rooms, but you won't be in here for very long. But let's have a look at the rooms here. We've got a bed. We'll get you perched up in that bed, mama. We'll get the external monitors hooked up. That's where we listen to the baby's heart rate and where we listen to what uterine activity is going on. And we just like to watch that for a little while just to see what kind of pattern of labor is going on. There is room for your support person to join you in this room. TV up here on the wall so you can also watch TV, help the time pass. During the time while you're in here, the nurse that's caring for you will be on the phone with your doctor or midwife, letting them know you're here, what's going on with your labor. You might see your provider check in on you, or perhaps they'll just make a decision on the phone with the nurse as far as what's best for you. Is indeed this baby on the way? Then we're going to get you right into a birthing suite. Or perhaps is it still a little early? Would you be better laboring at home at this point in your labor? So sometimes our mamas will go home with some instruction of what to do at home, when to come back, call if you have any concerns, that kind of thing. So this is the launching off place here in our assessment area. Now, outside the door from the assessment area, right across the hall, is our lactation office. We have a great team of board-certified lactation nurses that are here to help all of our mamas who are choosing to breastfeed. You might think, I have a breast, I have a baby, we can breastfeed. And in some cases, that's absolutely what happens. But sometimes babies need a little extra help learning to breastfeed, or maybe mom has some challenges that she needs some extra support in when it comes to breastfeeding. That is what our lactation team of nurses are here to do, to help you and baby that are learning to breastfeed. So let's walk and talk, and I'll give you some more information about our fabulous lactation team. All of our lactation nurses, as I said, they're board certified, meaning they have a lot of additional education and training and experience in helping moms breastfeed. But they also have mother-baby experience. They have been in the labor and delivery unit. They have helped in the postpartum. So they're really the nurses that have so much experience in helping moms, new moms, and especially breastfeeding moms. So you may or may not see them while you're here. Some of our mamas have no problems. Babies take right to the breast without any issue at all. But if you have any challenges, just know that our great team of lactation nurses will be here to support you and to help you in your breastfeeding experience. If you're a mama that's choosing to bottle feed, we do have bottles. We do have formula here, and your nurse will get you set up on that as well. Being a baby-friendly hospital, we are all about helping moms that want to breastfeed have all the support and resources that they need to be successful at breastfeeding. And that starts right here in the birthing center with our lactation team of nurses. All right, so here we are at the end of the hallway here at the entrance to our nursery. We have a level 3 neonatal intensive care nursery, meaning we can care for babies born as early as 26 weeks, depending on what their needs are. We contract with the neonatologists from OHSU. There's 4 of them that rotate through caring for those babies. And we also have a fabulous team of medical professionals that have additional training in what those babies need. From the nurse practitioner to the nurses to the respiratory therapist, even the pharmacist, all of them know how to care for those babies with those special needs. Now, not only is our nursery designed for those itty-bitty premature babies, but sometimes even a full-term or close-to-term baby will be delivered and just have some little issues that they maybe need to spend a night or two in the nursery under the watchful eye of one of our skilled caregivers in there. So your baby may or may not need to use our nursery, but just know it's here. We are so thankful for it. There are 23 private rooms in our NICU that are designed for babies, so your baby will never need to share a room. We also have some additional rooms that are set up for multiples. So if you are having twins, we had a set of triplets in there not too long ago, and the rooms are designed so that mom and dad can be right there with their babies as they're getting the care that they need. If your baby is born full-term, healthy and strong without any issues, they are going to stay in your birthing suite with you during your entire stay. Our nursery is designed for babies that need a higher level of care. So just be aware of that. There's no, oh, I'm so tired. Can you just take the baby to the nursery so I can get some sleep? We don't do that in our birthing center. In fact, studies show that moms who send their babies to the nursery so they can get more sleep actually don't get any more rest during their hospital stay. And what we found instead, it's so important, especially for that breastfeeding baby, to be close to mom in those early days and hours of birth. So we like to keep them in your room close to their families during their stay. All right, well, let's go ahead and head into a patient. So here we are inside one of our patient rooms. All of our rooms are the same. They are all what we call LDRP rooms. These rooms are designed for you to labor in, and in just a moment I'll show you all the things we offer for you while you're in labor. You will deliver in this room unless you're having a cesarean birth, and we'll talk about that in a moment as well. You will recover in this room and spend your postpartum time in this room. So it's one room during your entire stay. And our patients really like that. We don't shuffle you from one room to another. You come in, you put your stuff away, and here is where you stay until it's time to go home. So a few things that the room has to offer I just want to show you. First of all, when you come in, go ahead and make the room as comfortable for you as you can. Do things like adjust the lighting. For this video, we have all the lights turned on, light coming from the window, but for some women when they come in labor, it's just too much lighting and they want a more dimly lit environment. So mess with the window shades. We've got a light diffusing shade, you can see there partially lowered, and there's also a blackout shade. If you want to turn off some of the overhead lights and just turn on a few of the axillary lights, do so. Most women in labor do like the calming sense of dimmer lighting. It gives a greater sense of privacy. And when people come into a room where the lights are soft and dim, their voices soften, and they just understand what's going on in this room. So set up the lighting however you'd like. Here on the wall we have the thermostat. You can adjust the temperature to your comfort. Most women in labor, when their bodies are working hard, they want a room that feels a little cooler. So definitely adjust that. Typically after the baby's born, most mamas think, oh, it's too cold, turn that up, warm up that baby. So use your thermostat as you'd like. There's different cupboards you can put your stuff away. I've seen things taped all over these cabinets before. I've seen birth plans, I've seen ultrasound pictures, little onesies hanging, anything you need to keep your mind in the game and remind you what the hard work of labor is all about. So just make this room comfortable. It's not the same thing as being home, but we've tried to make it as relaxing and homey as an environment as we can, being here in a birthing center. We do not allow burning candles or burning incense, and that's a safety issue. But we do allow, if you want to use those aromatherapy diffusers where you diffuse essential oils, there are safe ways to do that. So talk with your nurse when you come in if you'd like to use aromatherapy in that way. We want to make sure that whatever it is you're poofing into the room isn't going to cause an allergic reaction with our nursing staff. So just make sure that she's on board with that. But there's good ways to use that aromatherapy for relaxation while you're here. So once the room is settled and it's kind of feeling as comfortable as it can for you during your stay, let's talk about what we offer for you while you're in labor. The first thing I'd like to point out here is these beds. Our labor beds, ladies, are made for you to have babies in. That's the way they're designed. There's our pillows, our wonderful hospital issue pillows, which will get you as many of these as you'd like, but they are just plastic. You have to have a way to sanitize them, and they're not going to compare with your fabulous pillow from home. So a lot of our patients do like to bring their own pillows from home. Bring your own with some colorful pillowcase so you don't get it confused with ours and leave it behind. But feel free to bring your own pillow. We have in your linen cupboard that you'll have right here in your room a bunch of extra pillows. We'll certainly get you as many of ours as needed to make your pillow fort in the bed. But again, feel free to bring your own. Over here under the window, we have our couch. That couch does make into a bed for your support person. They're welcome to stay overnight. We'll pull those back cushions off. We can fit it with a fitted sheet. We have blankets and more of our lovely hospital pillows. So you're welcome to use those while you're here. But again, if your support person would like to bring their own pillow, they're welcome to do that as well. So the bed, not the best place to be while you're in labor. We do know that getting up and moving around is good for the process and the progress of labor. But if you are in bed for some reason, just getting some rest, or if you've got the epidural and you're confined to bed, we'll just move you around and get you as comfortable as you can in the bed. Other tools that we have while you're in labor, we've got our monitoring device right here. This is the same external monitor that we had in our assessment area right here at the bedside. If you need to be monitored continuously, and if you are in bed, this is the monitor that we will use to listen to that baby, to pick up the uterine activity as well. We also have other ways to monitor you during your labor also. We have battery operated telemetry, which means you're not connected to anything except around your belly, and a battery operated device that you can take while you walk the hallways or while you sit in the bathtub. We also have Bluetooth technology, where we can monitor the baby wirelessly. And then we can also monitor baby intermittently with that handheld Doppler, similar to what your provider uses in their office for your prenatal checks. So different ways to monitor you. How you need to be monitored will be determined when you're here in labor. But just know there's lots of options when it comes to that. Also, while you're in labor, I'm going to pull out of this cupboard right here. All of our birthing suites have a labor ball. Or you might heard it called a birthing ball or an exercise ball. Either way, it's going to function and be a wonderful tool while you're in labor. Using a ball like this to sit on helps to open up the pelvis, make more room for baby. It's got a nice squishy, so as you sit on it, it's got to give. If you're having back labor, this is a wonderful tool to use. Another way we see mamas use it is even just putting it on the bed. Putting it on the bed, you can of course raise the level of the bed, and then we'll see mamas just leaning on it. getting the weight of baby off of their back, leaning on something soft and squishy. Ladies, you can do that for a lot longer than perhaps you could if you were just leaning on something hard. So great tool to use, many different ways to use it. You're probably doing some of reading right now in all those blogs and books that talks about our labor ball. But also while you're here, your nurse will give you some good guidance and in different ways to use that. So plan on that being available to you, again, right here in your room for you to use whenever you'd like. Other tools that we have, I'm going to talk about it, and in just a minute I'll show it to you, but inside your bathroom here, you will have your very own jetted bathtub. It's a standard sized bathtub, but it is about 6 inches deeper. So most mamas laying back can get that belly below the water line. Or some mamas just like to climb up and sit in the tub like this, keeping their baby belly below the water line. Some mamas just like to lay back and relax, but you will have that during your entire stay. In addition to the extra 6 inches of water, there's also those jets that get that water moving. Ladies, if you're looking for a more natural way to cope with the labor contractions, a lot of our mamas find relief by getting into the water. So just know that that will be available to you for, your labor. Now, if you're at all curious about a water birth, that looks a little different. Our jacuzzi tubs are intended for mamas that want a water, just to labor in the water. But if you're interested, you're considering, or you're planning an actual water birth where you have the choice to give birth in the water, that does not happen in our tubs. That happens in a birthing pool that we fill up and we bring into the room. And if you want more information about our water birthing program, we'll have additional videos, and of course talk to your doctor or midwife for more information about our water birthing program. But just know mamas will all have access to that jetted tub during their labor. And then of course, it's still here after you've had the baby. And in the recovery process, boy, does it feel good to soak in that bath, get that uterine muscle that's worked so hard birthing your baby, getting that soaking in the water is very nice. So look forward to that during your stay. So we've got the ball, we've got the tub. The TV is a great way to help pass the time. There are about 32 channels that play through the TV, local stuff, cable stuff. There's also on-demand movies, the new stuff that comes out at Redbox. You'll see that on your menu option there. There's also 4 music channels that play through the TV. So no commercials, just straight up music, 4 different options for you with that. That is all the media that we have to offer for you, and that's all our TVs do. So don't ask them to do anything more. If you want to watch a DVD, bring your laptop that plays DVDs. There is Wi-Fi in all the rooms, so if you've got your tablet or your device, you can watch. You pull up your Netflix, pull up Amazon Prime, whatever it is that you're wanting to watch. If you want gaming equipment, it needs to operate independently of our TVs. So our TVs do some stuff. You're welcome to bring your own other technology to bring in some media. If you want to listen to other music other than what we offer here, bring your device. Make sure you've got a charger, extra speakers, whatever you need to operate those during your stay. All right. So when it's time for baby to come, behind the cupboard here, we've got a little cart we pull out that has all the sterile equipment that your provider needs for the delivery. We of course have right here at the bedside oxygen on both sides of the bed. It's not uncommon for mamas during that pushing stage to need an oxygen mask for a little extra oxygen while she's working hard pushing baby out. So we have that right here. The bed is going to do all sorts of great stuff for the delivery. We can actually attach a squat bar to the bed, and that's a padded bar that comes up and over if you want to be in more squatting position. Some mamas just like to sit back and brace their feet up against the squat bar. So either way, that's something your nurse can help you with. The bed is also equipped with the foot supports. You can brace your foot in that. This is kind of a leg support. Partners, you'll really appreciate this because this will help support mom's legs while she's during the pushing stage. So again, your nurse will help you with all of these different transformations that the bed makes at the time of delivery. Once baby is delivered, best place for baby to go is right here on mom's chest, skin to skin. We'll put a warm blanket over the two of you, and that's the best place for baby to be. Number one, they're still connected. That placenta still inside, connected to that umbilical cord, which is still connected to baby, doesn't allow them to go very far. But babies don't want to go very far. They want to be close to their mama. Placed skin to skin on you, ladies, is not only going to help stabilize their blood sugars, not only going to help keep them warm, but it's also soothing and comforting to them because they can hear your voice, they can hear your heartbeat. Those are familiar sounds to them. So we don't want to get in the way of that. Nestle that baby up right up close to you while we finish the delivery process. If you're planning to breastfeed, the breasts are right there too, and it's a very natural time for that baby to want to latch on and nurse. In fact, probably the most alert your baby will be after delivery or for breastfeeding is going to be after delivery. So in those few hours immediately following birth, babies are like, what just happened? Something's different and I need a meal. So they're there ready and willing to eat. After those first few hours, they kind of go to sleep, and then trying to wake them up and keep them awake for all those breastfeeding opportunities is a bit of a challenge. So take advantage of that first feed that you get. We don't want to get in the way of that. All the assessments we need to do on baby are going to happen right here with that baby skin to skin. Now, sometimes babies need a little help transitioning to life outside the womb. So much happens the minute that they're born. If they need a little extra help, we might bring them over here to what we call the Panda Warmer. This is not normally kept in the birthing suite. We bring this in when we know that birth is nearing. We'll bring this in the room, we'll plug it in, and this is where we can, if baby needs any assistance or any resuscitation, we can do it right here in close proximity to mom, right here in the room. So this has got a nice warming light that'll help keep baby warm. We've got oxygen, suction, everything here. If we need to help clear their airways, help them breathe, we can do that right in room near mom here on the Panda bed. This also will be what we use to weigh the baby, what we use when we put on their first little diaper and give them a full checkout. And typically that's done after mom has had plenty of time to breastfeed. We've put all our stuff away from the birth. If you've had an epidural, we've turned that off so mom's be able to regain that feeling and sensation in her legs. And typically about the time we get mom up and out of bed into the bathroom to get cleaned up, typically that's the time we're going to pass that baby off to your support person. We're going to go ahead and do that more extensive assessment on them. And typically, while mom's in getting freshened up, we'll get her bed all stripped down. We bring in a nice thick memory foam mattress topper that makes this bed so much more comfortable for the remainder of your stay. So typically, as mom reemerges out of the bathroom, a new woman, so thankful not to be pregnant anymore and having to get to see and meet her baby, she'll crawl back into bed into what we call the mommy nest. And mom's just kind of settling there. Perhaps they take baby back. Maybe support person's over here doing skin to skin. Skin to skin isn't just for mama. Skin to skin is great with dads or another support person as well. So either way, that baby's nestled in with someone. And then at that point, we'll get this Panda Warmer taken out of the room. What you can expect for baby the rest of the stay, I want to show you, is our Halo bassinets. This is the hospital version of the Halo bassinet. Tight quarters there, but I'm going to show you what we do with this. This would get taken right over to mom's bed. And it's nice because it's designed to do this. It'll slide right underneath mom's bed. Excuse me with the cord here. I told you we are not professionals. And as you see, this side here can lower. So we can swing this around. And if mom is in bed cuddling with baby, but oh, my lunch is here, she can set baby down real close to her while she eats her lunch. Or if mom's feeling drowsy and perhaps her support person is over here napping on the couch, it's a safe place to put baby while she just closes her eyes for a time. We know with safe sleep habits, as tempting as it is to nestle that baby in, snuggled in nice and warm for a nap, we know, ladies, as tired as you are, perhaps you're on some pain medication following the delivery, it's not safe to have that baby snuggled in while you take a nap. The safest place for baby to be is in the arms of an alert adult or in their little bed right close to you, and those little squeaks and cries, they'll wake you up if you need to grab baby again, but this is the safe place for them to be, and that's why we have these specialized beds, making it as easy as possible for mamas. Also, we have here everything that you'll need for baby during their stay. Their little diapers, little newborn diaper. We got a whole package of those in here along with the wipes for baby. As far as what we dress our babies in, again, a lot of times our babies are just naked, wearing their little diapers, skin to skin with mom or their other support person, or maybe they're just swaddled up, nestled up in their bed. If you want to dress babies, we do have these little undershirts that we provide for our newborns. They're super cute because they're so tiny, but if you have something cuter than this at home, feel free to bring it with you. You can bring something fun to dress them in, some cuter swaddling, something to put on their head, whatever you'd like to do, but this is what we provide for you. The undershirts that we have, the little ducky blankets that we use to swaddle, those do go through our laundering system, so we ask that you do not take those home. Just use them while you're here. And along with the car seat, bring at minimum one go-home outfit, whatever is weather appropriate for baby. So bring more clothes if you want to dress them in something fun here, but at least bring the go-home outfit with the car seat. Also in here, we have their little hats. So we've got several in there. These get stretched out and they get kind of gnarly, so you just toss them and grab a fresh, clean one. But again, those are disposable. We have a little comb in here in case your baby has hair. We also have in here this, it's called Baby Organic Bubbly All-in-One Wash for baby's first bath. We wait a minimum of 8 hours for baby's first bath, and that's really in baby's best interest. It's a lot of transition for baby to come out of the womb where they never had to regulate their own body temperature. Here they are out in a room that's 69 degrees. That's quite a shock to their little system. So we want to give them some time for their body to adjust to this new environment. It can be very stressful, and babies can burn a lot of calories trying to stay warm if we, right after birth, put them in a sink full of water for their first bath. So we're going to turn around right here and I'm going to show you where baby's first bath happens. These sinks are designed for that. We'll lay a towel in here. You can see it's got a bit of an angle there. We'll lay a towel in there, set baby in for a nice warm first bath. So again, we're going to wait at least 8 hours, and some parents actually these days are choosing not to bathe their baby. Not a full immersion bath. They may take a washcloth and wipe baby down, but some parents choose to wait until they get home and even until baby's a little older for a full bath. And your nurse will give you more information about that. Is it safe to? When? Why? Why would we want to wait? When you're here as a patient. They'll give you all sorts of good information about that baby's first bath. So we'll provide everything that baby needs while they're here. Just be prepared for them as you go home. Also for you ladies, we will provide for you everything you need in the bathroom by way of sanitary supplies. Make sure you have a supply going at home, but we'll have everything that you need here during your stay. Our bathrooms also have hair dryers, one less thing you need to throw in your hospital bag. While you're here, we talked about feeding babies. We talked about how we do encourage our mamas to breastfeed. We know that breastfeeding is best, not only for baby, but so many health benefits for mom as well. But let's talk about feeding you ladies. You will have a menu card in your room that shows you breakfast, lunch, and dinner, all the options that you'll have to order from during your stay. Also during this time when things look a little different during the coronavirus, we are also going to be feeding your support person 3 meals a day just like you. Consider it like a date every meal. You don't have to cook it. You know, dim the lights, have a little date here in your room with the meals that you order together off of this menu. So support people, you don't need to go out and get food. In fact, we discourage you from going out. We want you to be here, stay where it's safe, minimal exposure to germs in the community, and plan on being fed here. So in addition to the meals we'll get from the cafeteria, which all the instructions of how to order is on the back, and your nurse will make sure that you're ordering that. Oh, and also I'll mention too, all the dietary information that you need. If you have a specialized diet, if you're gluten intolerant, or if you are vegetarian, vegan, whatever, we can accommodate those diets. So that information is there too, and you can always talk with our dietitian to make sure your nutritional needs are cared for. But also we have in the birthing center here 2 kitchens that we can get you snacks in between, get you a cup of coffee, get you a little something to tide you over until your meal comes. So your nurse will let you know all those options when you're here. We also have in our birthing suites mini fridges, so you can count on that if you'd like to bring any food from home, anything special. I remember one mama who had her first meal after she had her baby. She wanted sushi. And if any of you mamas have been missing out on sushi while you are pregnant, because we know that's not a good idea while you're pregnant, well, it's perfectly fine after you've given birth. Perfectly safe for breastfeeding moms. Eat all the sushi you want. So that mama had her favorite sushi takeout place. They stopped on the way to the birthing center, tucked that meal in the fridge, and that was her first meal. So use that fridge as you wish. There's microwaves in the waiting area as well, so if you need to heat something up, you can. But we'll make sure you stay fed and are nourished, and your support person while you're here. All right, well, I think that wraps up this tour for today. Thank you so much for tuning in to this video. If you have further questions about what to expect or any questions, especially regarding safety, any concerns you have, we encourage you to talk to your doctor or midwife. And of course, here at the Birthing Center, we'll put our phone number and email address there at the bottom of the screen, and you can contact us that way as well. So until then, stay safe, and we look forward to seeing you when it's time to have your baby.